Hey everyone, welcome back to my channel. My name is Jessica. I'm a board-certified pediatric nurse practitioner and a first-time mom. Today we're diving into something super common in children, ear infections, also called otitis media. If you've ever spent sleepless nights with a crying toddler or crying child and wondered if it was their ears, this video is for you. Let's get to it. So first things first, to understand ear infection, I'm going to give you a TLDR or a super quick crash course on ear anatomy. The ear has three parts. First one is your outer ear, so everything outside plus the ear canal. Number two is your middle ear. So basically that is air fluid space behind the eardrum. And then number three is your inner ear. So this is basically where balance and nerves live. When you think about otitis media, this is affecting the middle ear portion. So it's a middle ear infection. If you think of otitis, so O or oto is ear, itis is inflammation, and then media is middle ear of or a middle structure, right? The middle portion of a structure. So you're thinking a middle ear infection or inflammation. So what is it and how does it happen? Otitis media is usually when fluid builds up in that middle ear space and gets infected, usually after a cold or congestion. The eustachian tube, which is a little tunnel that connects the ear to the back of the nose, usually gets blocked, it gets swollen, and then bacteria and viruses love to live there, throw a party, and just live there unannounced. Also, just a quick side note so you don't get mixed up when we talk about ear infections. Otitis media is different from otitis externa. Otitis externa, outer. We're talking about the outer ear canal infection here, so this is very different, and this is usually what we call swimmer's ear. So today we're going to talk about otitis media, so basically the middle ear infection behind the eardrum. So what are the causes and why does it happen? Like I said earlier, it's usually from blocked eustachian tubes from colds, viruses, allergies, and plain old anatomy. Some people are just more prone to it because of their ears are and the anatomy of their ears. The main bacteria that can cause this are three things: Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Sounds like Harry Potter spells, but you get the gist. Viruses like COVID, RSV, and flu can also set the stage for otitis media. So the most common age groups for this is from 6 months to 2 years old because their eustachian tubes are usually smaller, more horizontal, and easier to block. So what do parents notice? Signs and symptoms for otitis media include ear pain. That's usually one of the first things that they come in for. Typically though, if they're not able to communicate yet, they usually tug their ear a lot. Number 2, fevers. 3, fussiness or poor sleep. Number 4 is some drainage are coming out as well. And then number 5, usually some hearing changes if there's persistent fluid in there. So if you're suspicious for otitis media, it's time to see your healthcare provider. The only real way for us to know is by doing an ear exam with an otoscope. When I look in the ear, here's what I might see. A suppurative otitis media basically looks red, full, dull, sometimes with pus in the back of the eardrum. A non-suppurative otitis media is usually just looking pretty dull, sometimes might have bubbles in it, but usually does not have that pus component. And then number 3 is perforation. So basically perforation means popping. So basically there's a lot of fluid builds up in there that it creates a hole and pops that eardrum, making it perforated. So treatment and management. Treatment for otitis media is with oral antibiotics. The first line is usually a high dose amoxicillin. If your kiddo is allergic to amoxicillin or any penicillins, make sure that you mention that to your healthcare provider so that they can look at other options for you. If the eardrum has ruptured or perforated though, like I mentioned earlier, they probably likely add some topical antibiotic ear drops on top of the oral antibiotics that they prescribed. Other management options as well as treating the fever or the pain with Tylenol or Motrin if they have colds, if they have congestion, doing humidifier, nasal suctioning, saline rinses, all that good stuff to help that. Or if it's allergy related, you can do the antihistamines or Flonase, whichever your provider would recommend. So just a couple of tips with giving antibiotics. With oral antibiotics, make sure you completely finish the course even if your child feels better. With topical ear drops, there's a difference between when they're younger than 3 and over 3 years old. I will attach a link from the American Academy of Pediatrics in the description below regarding the specifics if you wanted to do that. But basically, if they're less than 3, you basically pull downward and back. And then when they're over 3, upward and back, and then drop it with the prescription that you have. Let them lay there for a little bit until, so that the medicine can get in there, and then they should be good to go. So most ear infections get better, but when they're not treated, they can cause hearing loss, chronic infections, and can spread to other nearby structures. Another thing to note is recurrence. If they're having recurrent ear infections, usually about 3 in 6 months or 4 in a year, it's probably warranted to send them to ENT, the ear, nose, and throat doctors, to just make sure that everything looks good, or if they need ear tubes. So what can you do to prevent them? Number 1 is good hand washing. Number 2 is avoiding secondhand smoke. Number 3 is being up to date with vaccines. Number 4, breastfeeding helps lower the risk. And then number 5, making sure that they're upright after feeding and not laying flat. Regarding follow-up care, it usually depends between age and symptoms. A lot of providers like to follow up on those ears and recheck those ears within a few weeks, especially if there was fluids or if there was any sort of rupture or perforation that happened. So that is otitis media in a nutshell. Middle ear infection, super common in kids, easily treated with antibiotics when needed, and important to follow up on if it keeps happening. If you found this helpful, then I did my job. Don't forget to like, comment, and subscribe to my channel for more child healthcare tips.